everybody, Dr. Dusty Mattingly here. Today I'm going to go over some information with you in regards to chiropractic care and your shoulder. All right, so let's go over some of the basic anatomy of your shoulder. First, it consists of the collarbone, which sits right here. Then you have the arm bone, or the humerus, sitting right there. And then you have the shoulder blade, or the scapula, which sits right back here. So those are the bones of the shoulder itself. Now, you also have some muscles there, and the first group of muscles I want to go over is called the sits muscles. Those are actually the rotator cuff muscles of the shoulder, and it consists of the supraspinatus, which sits right here on the top of the shoulder blade. You have the infraspinatus, which is back here, kind of in the lower part of the shoulder blade. Then you have the teres minor, which is in this area. And then lastly, you have the subscapularis, which sits on the front side of the scapula, and it acts as a kind of a joint between the scapula and the rib cage, and it allows for some movement of that scapula as it relates to the rib cage and the movement of the arm bone itself. So that's the sits muscles. Also, you have the deltoid, which is basically a muscle that kind of covers the entirety of the shoulder itself. You have the front part of the deltoid, the side part, and the back part. The deltoid is the strongest muscle of the shoulder joint itself. Now, one of the things about these sits muscles, they're actually called the rotator cuff. And the sits muscles actually stabilize and hold the arm bone into that joint. And so rotator means like movement. Cuff is actually kind of covering, and you can think of the cuff as the like at the end of your long sleeve shirt, you have a cuff. That's basically what we're referring to when we call it the rotator cuff. All right. So again, with that kind of a covering of the muscles, it allows for the greatest range of motion of any other joint in the body. All right, so now one of the things that can go wrong with the shoulder joint is actually the nerve supply from your mid to lower neck in this area right here. So these nerves go out of this area into the shoulder joint and supply all the nerves to the muscles and joints itself. Now, when people get pinched nerves in this area of the neck, they begin to have problems with this area of the shoulder. So you start to have problems with range of motion where you can't lift your arm, start getting some aches and pains into the shoulder, and some of it can be very painful. You can get sorenesses to the touch in that supraspinatus and the infraspinatus. It can be very, very tender. So if you're starting to have problems with your shoulder, you need to come in and get a chiropractic evaluation of that shoulder joint and the neck, as that could be a chiropractic problem. So our contact data is below, so give us a call. I'd love to get on the phone with you or have you come into the office for a free evaluation of your shoulder problems. And I do some pressure point therapy on those areas, like the supraspinatus, the infraspinatus, and do some of the pressure points in your neck to really look at what is going on with your shoulder. So again, our contact data is below. Look forward to seeing you in the office soon. Thanks.